in a patient centricity or centric world, I think it would be the patient that has a lot of knowledge. They will have visited the internet, have gone into detailed information. Just like you have TripAdvisor, people would rate and benchmark hospitals, medicine, outcomes, etc. And that's unfortunately for many doctors, it's going to be a very stressful situation, but that's the power of the internet, the transparency.
When you want to actually be patient-centric, you have to be person-centric first. How do these people live their lives? How does that living affect their health? What will we do to help them manage some of the changes that they will need to bring into their lives? And then what role will therapy give them or afford them in improving that status of health with all of those interventions and management schedules as well?
The other limitation with the term patient is that immediately puts them into a state of disease management or illness. And of course, when we're talking about health now, it's far broader than that, and we should be considering that a well person is also managing their health, and so in that context they're not a patient. And even if we are talking about a patient with a disease, we should be considering the aspect of the language and the lexicon that we use when we're talking to them about illness, because the negative language, if you will, that we use that positions them as a patient really reinforces a sense of sometimes despair, when in fact something like health optimism, which is self-evidently is about speaking more positively about managing a condition, actually correlates to better health outcomes in any event.
For me, patient centricity is putting the patient at the heart of the whole, putting the patient at the heart of health. So seeing the condition or the illness or the disease from the patient's point of view.
The transformation of our knowledge in terms of the diseases and the moves into personalised healthcare, and also the technology available for devices, means that we can become incredibly patient-centric. Even for the patient who won't be using, say, a biomarker-directed biological, but will be using an age-old Symbicort or Seretide or a preventative medication of that nature, they will be able to use technology to personalise their own treatments for their own condition on that very day.
The value of the industry, the pharmaceutical industry, biotech industry, in whichever form, really comes to its fullest value when a patient has taken a medicine, benefited, and whatever that value to them may be, they're either better from a disease, they're able to conduct their life in a way they see that they wish to, has been achieved. The promise of the pharmaceutical industry has been achieved.
Now you've got a patient that's central to everything. You have an industry that needs to make massive change in recognising that that patient is aware, informed and educated. So patient centricity for me is when the patient is now being taken as the focal point rather than as a subject.